Hello everybody. Today we are going to talk about diabetes in Aboriginal and Torres Strait Islanders. Before we begin, we wanted to acknowledge that we are on a traditional Parramatta land and it's always be so. Always we pay our respect to elders, past and present. First of all, I would like to introduce my group members, myself Biresh, Baisali, Riyadh, Barsha, Ashin. Today in this video, I, Biresh, have given my voice in which our group will elaborate and cover the issues of diabetes mellitus amongst the Aboriginal and Torres Strait Islanders people. Before we giving you any information, let us familiarize you with the topic included in the presentation video. Foremost, we are going to discuss how culture plays role in Aboriginal Torres Strait Islanders' health. Next, we will talk about diabetes and its consequences among Aboriginal and Torres Strait Islanders, followed by associated social determinant of health. Furthermore, we will examine the importance of health promotion as a healthcare need. Lastly, we will address the culturally competent and safe nursing practice in relation to diabetes in a remote area. It is a well-known fact that the traditional owner of Australia are Aboriginal and Torres Strait Islanders. They have coexisted with this land for over 6,000 years. During this time, they were healthier as opposed to today. The traditional food culture at the time was to hunt and gather. The unfair laws and communicable diseases brought by the first flight resulted in Aboriginal and Torres Strait Islander being driven away from their traditional land, introduced to easily contracted diseases such as smallpox, ill practices of alcohol, and drugs resulted in a lower health status among Aboriginal and Torres Strait Islander community. As a result, their spiritual connection with their lands were broken, which led them to live an inactive life. The inactive life caused them to develop chronic diseases such as diabetes, heart disease, and many more. First of all, what is diabetes mellitus? Let us explain to you what is diabetes mellitus and how much it affects Aboriginal Torres Strait Islanders' health. Diabetes is an epidemic of the 21st century and is one of the biggest challenges confronting Australia's healthcare system. Approximately 1.7 million Australians have diabetes, with 280 Australians being diagnosed with every day. To put things in perspective, in every 5 minutes, someone is being diagnosed with the diabetes. Diabetes is a chronic disorder in which a person has a high blood sugar level, either because the body doesn't produce enough insulin or because cells do not respond adequately to insulin produced. There are main two types of diabetes, namely type 1 diabetes, type 2 diabetes. Type 1 diabetes is characterized by autoimmune destruction of insulin producing cell in pancreas, which means when pancreas doesn't produce insulin. What is type 2 diabetes? Type 2 diabetes is most common form and is characterized by reduced production of insulin and inability of a body tissue to respond fully to insulin. Especially Aboriginal and Torres Strait Islanders are 3 times more likely to have type 2 diabetes compared to non-Indigenous Australians. There are many associated factors to develop diabetes, such as obesity, family history, less physical activities, stress, and habitat of alcohols, and smoking. According to Australia Indigenous Health and Welfare 2007, diabetes is linked with this socioeconomic status, for example, the greater and the environmental, social and economical disadvantage experienced by Aboriginal and Torres Strait Islanders people, the higher level of type 2 diabetes. As a result, it will increase the risk for associated problems and other chronic conditions in the population. If this chronic condition is left untreated, it will increase the risk of other serious conditions like heart disease, diabetic foot, stroke, and renal failure developing in the future. To justify the seriousness of diabetes among Aboriginal and Torres Strait Islander, let us show you the statistics. This graph is a form of survey conducted by Australian Bureau of Statistics in 2013, where it is found that 10% of Aboriginal and Torres Strait Islanders in remote areas are living with the diabetes. It is essential to remember, due to the lack of awareness about diabetes mellitus, there could be even more Aboriginal Australians affected by this. According to Australian Institute of Health and Welfare 2014, Aboriginal and Torres Strait Islanders males and females were more likely to be hospitalized for each type of diabetes than non-Indigenous counterpart. According to above table, the disparity of greatest for Aboriginal and Torres Strait Islanders females with the principal diagnosis of type 2 diabetes, which were 8.1 times more likely to be hospitalized than non-Indigenous female. It is well known fact that economic and social conditions such as money, power, resources determines one health status. The social determinant of health are causes of the causes which are responsible for health inequities. There are three social determinants of health related among Aboriginal and Torres Strait Islanders in context to diabetes, which we will be focusing on. These are education and literacy, health practices and coping skills, and access to healthcare services. The few following slides will show you up to which extent social determinant of health impact Aboriginal and Torres Strait Islanders' health. Education is one of the important social determinant of health affecting the health among Aboriginal community. In 2015, Australian Curriculum Assessment and Reporting Authority found that there was a gap of 24.1% between non-Indigenous and Aboriginal and Torres Strait Islanders students attending in a school in very remote areas. This is a large difference highlights the continuous need to encourage and empower the youth and their community to receive basic education where they are able to implement their knowledge in their daily lives. It is vital to educate the youths about the danger of unhealthy food, alcohol, drugs, as well as long-term impact it has on the individual's body. Secondly, we would like to focus on the health practices and coping skills among Aboriginal and Torres Strait Islanders, providing information about nutrition and correct food group that should be consumed. There is need to train the youths and their communities to make right decision and breaking the cycle. An initiative started in Apinimpa Cave York Health Council called Good Food for Good Sugar, which was in 2016 illustrated a healthy diet suitable for an individual suffering with the diabetes. The focus here is on eating regularly and not skip meal, spreading out the sugar throughout the day, eating more whole grain and high fiber food, and choosing products with the reduced fat instead of deep fried foods. Furthermore, the poster also lays out the healthy alternative in every meal throughout the day. This ensures that a person struggling with the diabetes is not stuck with a mundane meal every day. By providing these healthy alternatives, a diabetic patient will be more willing to follow their diet and not return to unhealthy and fatty foods. These initiatives is an excellent examples of easy to follow meal guidelines, which acts as a coping tool for a new diabetic patient. Now we will be discussing about our third and last chosen social determinant of health, that is access to healthcare services. According to the survey conducted by National Aboriginal and Torres Strait Islanders Health Survey in 2005, it is found that 1 in 7 Aboriginal Australia in remote area needed to see a doctor in past 12 months, but didn't go. Aboriginal and Torres Strait Islanders female were more likely than Aboriginal males to report that they had needed to go to doctor or a dentist, but hadn't gone. Factors such as distance, cost, long waiting times, and transport were reported as a main reason which deterred them from going to see doctors. Therefore, there are numerous Aboriginal and Torres Strait Islanders that are living in a diabetes but not aware of that they are hesitant to travel to their nearest healthcare center. Aboriginal and Torres Strait Islanders have been reluctant to seek healthcare services due to Western dominant model of care used by healthcare profession. Additionally, a lack of understanding towards their culture has also been one of the reasons that have influenced Aboriginal and Torres Strait Islanders from going to any healthcare services centers. In order to tackle this issue, it is essential to create culture awareness in all remote health services centers. Hence, it makes evident an importance of a health promotion as well as to improve health, which we'll discuss in our next slide. As we have seen the previous slides emphasize the role of a health promotion in Aboriginal health, what it means by a health promotion and how it can be done. World Health Organization, WHO, describes health promotion as the process of enabling people to increase control over determinant of health and thereby improving their health. Health promotion works on the 3 guideline principles. These are advocate, enable, and meditate. Health promotion by and with the Aboriginal and Torres Strait Islanders plays a significant role in closing the wide gap in health status that this community has compared to other Australians. The higher distress of diabetes in Aboriginal and Torres Strait Islanders people can be minimized with the help of health promotion strategies. These strategies must consider as there is much lighter scope to prevent illness among young people. The operations of Aboriginal Community Controlled Health Services, ACCHS, established in Redfern, was first initiative in relation to Aboriginal and Torres Strait Islanders health promotion strategies. Now, let us introduce you to some of the projects established by the government and other organizations to upgrade health outcomes around diabetes in Australian Aboriginal community. It includes Guri Diabetes Complications and Assessment Clinic, which was directed in 2004. During the clinic session, local Aboriginal and Torres Strait Islanders community members were provided with a multidisciplinary team within one clinical settings. Secondly, looking at the Better Living Diabetes project, which was implemented by Gundir Aboriginal and Torres Strait Islander Corporation for Health Services in 2001, received positive response from the community. The reason it was a beneficial because it was arranged with the community consultation. While looking forward, the Laramba Diabetes Project, Worli Urljang Diabetes Day program, as a fewer health promotion programs implemented for Aboriginal and Torres Strait Islanders people. Although both the government and non-government organizations produced and reproduce various health promotion tools, but most of them are implemented without carefully assessing its effectiveness. In addition to this, the main drawback to delivery community-based diabetic education is related to lack of Aboriginal resources as well. To upgrade the Aboriginal Torres Strait Islanders' health, there are a few techniques that can be used as a health promotion tools. The health promotion strategies which we are going to focus on includes two compartments. Firstly, to increase awareness among the communities. Secondly, to strengthen health resources with the cultural competencies. As discussed earlier in presentation that the diabetes is 3 types more likely to occur in Aboriginal and Torres Strait Islander people. It is also associated with an array of complications. If the diabetes remains untreated, it can lead to complications like diabetes-related foot disease. The rate of diabetes-related lower limb amputation due to foot disease is remarkably higher in Aboriginal and Torres Strait Islanders, especially in rural and remote areas. It is a report which is mentioned in SARA 2016. Thus, it is to create awareness in the community by conducting diabetes awareness program which involves community members and elders. For example, services for the Australian rural and remote allied health, which is SARA, developed the National Aboriginal Diabetic Food Program to encourage people around about food care. The use of local language, media, and artwork was emphasized in the program. Additionally, through the program, it was significant that the language to be used for the food care message was created using local cultural knowledge and was discussed with the Aboriginal elders. Now, moving towards the health resources available in the relation to Aboriginal health are not defining and efficient. There is a need to have a new resources. Here, we will formulate some different ways in which resources can be strengthened with respect to culture competencies. The first step can be recruiting more local Aboriginal health workforce through the involvement of community members in healthcare workforce. Culturally, safe healthcare can be provided to the Aboriginal Australians. It must be noted that Aboriginal health workforce can be effective educating and non-indigenous staff by making them culturally competent. Thus, it results in providing culturally safe healthcare delivery. Furthermore, elders and Aboriginal health workforce should be considered as a greatest resource while providing health services. Alternatively, if an Aboriginal elder is not available in the community, we can still consult the highest respected person in the community to create equitable and appropriate program or services. Nurses and midwife profession plays a significant role to improve the health of Aboriginal and Torres Strait Islander people to reduce health inequity. According to the Nurses and Midwifery Board of Australia, NMBA, and Professional Code of Conduct 2008, principal responsibility of nurses is to respect culture, ethnicity, and beliefs of the patient. For example, nurses can show respect by avoiding direct eye contact without being judgmental and using gesture as a means to communicate with the Aboriginal patient. Nursing standard of a practice must comply with the therapeutic relations of a patient safety. Nurses should engage themselves in a continuous professional development to provide cultural sensitive care. This can be carried out by undertaking a specialist diabetes training, which incorporate Aboriginal and Torres Strait Islanders learning, cultural safety, and a holistic approach to care of Aboriginal people with the diabetes. Furthermore, awareness building regarding mental health and how it affects diabetic patients to the control of the blood sugar plays significant role to enhance it. In addition to this, specific nursing care should involve screening and early detection of type 2, promoting self-care, regulatory blood glucose monitoring, periodic urine check, and oral therapeutic. So it is clear that diabetes mellitus is a significant health issue for Aboriginal and Torres Strait Islanders, especially residing in remote areas, that the lack of education and access to health services further worsen prevalence and consequences of diabetes. There is to appoint Aboriginal community member in Aboriginal health workforce and introduction of diabetes program. It can help in promoting Aboriginal health at culturally safe level. Also, nurses play important critical role in providing culturally competent health care. Nurses involve themselves in therapeutic relationship with the patient and providing relevant information with the diabetes. In the end, cultural competent nurses are able to promote health and can increase positive health outcome among Aboriginal and Torres Strait Island. This is all about topic. Some of the references we have taken to build up this PowerPoint presentation is mentioned as below, which is Apinima Cape York Health Council, Australian Bureau of Statistics, Department of Prime Ministers and Cabinet, and all different resources, that is all different resources which is listed here. And we're very thank you. And if you have any questions, please email us in email 18750762 at student.westernsydney.edu.au. And if you like to discuss on furthermore, you can call on my mobile 040-1525-063. And also we're very thankful to our teacher David, who has helped us to do the best PowerPoint presentation in a way it should be. And thank you to Western Sydney Uni to giving us opportunity to explore our talent and knowledge, skills, and continuous professional development, to maintain continuous professional development for our future. That's it. Thank you. Have a good one.